We've come to the sponsor perspective portion of our program. Please welcome Lynn Riley, President of Pharmacy Benefits Dimensions, and Leanne Boyd, founding partner and CEO of Levinti, in conversation with Kathleen Koch.
Thank you, Sarah, and good morning, everyone. And Leanne and Lynn, thanks for joining me. So in that conversation, we just heard about some of the proposed reforms, PBM reforms, that Congress is eyeing to help reduce prescription drug costs, right? Now, you are both CEOs of PBMs, yet you support reform in your own industry. Help us understand that.
Sure, absolutely. As PBMs that operate in many ways that are consistent with a lot of the measures in the proposed reforms, we are very much in support of the reform out there. We believe it's the right thing for patients, the right thing from plans, the right thing from employers, all facets of the industry. We believe strongly that it does help lower pharmacy cost. We see it in our practices every single day. It's one of the reasons why we've banded together in forming Transparency RX, our coalition that gives us voice in the marketplace about how we do practice PBM and have been operating with these business practices for quite a long time.
Yeah, so a little bit different perspective on our end. So stepping back, we were actually founded by asking many of the questions that are being asked today. And so we were actually started by 2 graduate students at the university who this was their thesis, who said, how can we change our community in the healthcare? And in the 90s, they turned their attention to drug costs because they were starting to rise. And the answer that they kept coming back to was the PBM as one of the biggest barriers to information, and as well as not being able to see what was actually happening with drug pricing.
So it was evident early on.
Early on. I'll go back to the days Lipitor had just hit the market. It was a big blockbuster then. And so trying to figure out how to constrain those drug costs. And the answer all the way through as one of the biggest costs to the plan, as well as one of the biggest barriers, was actually the PBM. And so they brought everything in-house and started doing it themselves. And so we have been doing a transparent model for 30 years. So this works. What we're trying to do today and what's happening in terms of reform and the model that Leanne has, it works. And we've done it for 30 years very successfully.
So you are then what are called transparent PBMs. Can you help us understand what that means? Because it does sound like you operate very differently from the large 3 PBMs that currently control roughly 80% of the market.
Yeah, that's correct. We do operate very differently from the market that's dominated by that 80%. To keep it very, very simple, it really comes down to our revenue models. And in the case of Levinti, we are a pass-through transparent business model. We charge a simple admin fee for the services we provide to our patients. Every bit of discounts, every bit of price concessions get passed through down to the patients and to the plans that are funding the pharmacy benefit.
And your fees have no linkage to the cost of the prescription
drugs?
Correct.
So
wow.
as contrast, other PBMs will have many forms of revenue. We heard a little bit about spread, which is a markup of the drug at the pharmacy counter. Rebates is a big piece. All of those link very, very closely to the cost of the drug. And
the rebates are where the PBM, the larger ones, keep the rebate and don't pass it on to the consumer.
Many will keep large portions of those rebates and link very closely to the price of the medication. Many are focused on specialty medications, encouraging the high utilization of those very, very expensive medications that drive a lot of rebates. So there is quite a difference between our revenue models when you compare the traditional PBM in the marketplace versus a transparent PBM.
Did you want to add to that?
I'm going to add on with a couple examples because everything Leanne said is correct and pertains. So example, if we're talking about patients, we recently had a new client come on first of the year with us, and one of their members called us and said, I have not started my breast cancer medication because I can't afford it through my previous employer who had one of these other PBMs. And she said, what can I do? And I haven't even told my physician I haven't started it yet. So we looked up the cost of the drug. They were going to charge her $4,000. And we looked up our
$4,000
$4,000
a month?
A month, correct. And we looked up our cost, it was $300. So that is the difference that Leanne is referring to in that spread pricing, that difference. So either that PBM was, really, really bad at negotiating drug prices, or they were, taking that profit and putting it somewhere else. And so, that is what we're talking about in terms of those differences. They're big, meaningful dollars that have a difference in patient care.
So then, this means that companies that utilize transparent PBMs like yours can realize a dramatic savings and then pass that on to their patients. Explain to me, is that how it works?
Absolutely. By eliminating many of those layers of cost in that revenue model, eliminating spread completely, immediately patients can realize lower drug cost at the pharmacy counter with passing through things like rebates to plans, to patients. It helps with the premium conversation. And the last piece is just really helping plans and patients choose good, clinically effective, cost-effective drug options, as in the case of Lynn's example.
Now, Lynn, I assume that you wouldn't be here, the two of you, if your companies weren't both thriving, weren't both making a profit. So is it the case that, that your companies are actually sort of living proof that these reforms Congress is eyeing, that they can work?
Yeah, I'm going to jump in. Absolutely. I mean, I started as the intern. I was there when these conversations, I know I just aged myself in this room, but I was the intern listening to these conversations in the early 90s and how they were going to do this. And so I absolutely think that this is living proof that it can work 30 years later, and we've been able to manage costs, even so much so that we're seeing that impact our community, going back to that question of how can you impact the community. So one of our school districts, who's part of a coalition in Buffalo, joined and moved to this transparent model, and with the savings they had alone, they were able to add an extra teacher. So that's a huge impact. That's creating jobs, that's educating our children, just in what they saved in drug pricing, which, that doesn't seem right, but it's how this world we're living in is working, where you're choosing between, a teacher, a job, or paying, a PBM, and that's not how it should work.
Now, the two of you, between you, have more than 42 years of experience, right, leading PBMs, and you have seen the market change, the industry change. Talk to me about how tough it has been to buck that trend that has so enriched your largest competitors.
Sure, it definitely has been a journey. I think when we first started, we're closer to 13 years in the industry. When we first started, it was just even the conversation of, can pass-through transparent PBMs be viable in the marketplace? Can they really deliver lower cost? Fortunately, we've exceeded that ability to demonstrate our value we bring to clients. But there's a lot of barriers that are in the marketplace still today. Plans being able to access their data so they can look at what costs may be with other options in the marketplace, create barriers to that competition, the ability to shop for your PBM services, the ability to even do a lot of flexible plan designs. There's a lot of things that prevent employers or plans from making decisions and pursuing a different type model today.
So, Lynn, I know that you are both part of this, this coalition that is pushing for change. So what comes next? What are you hoping to see?
I'm hoping to see some of what we've been doing actually make it into a level playing field, to get past not just on the government side, but the commercial side as well, of spreading this true model, this transparency, access to data, being able to see what you're paying for, make decisions about healthcare based on your actual spend and your actual drugs, and not just be blind or taking somebody's word, and having that spread across everybody in the country, not just segments of it. So I'm really hopeful for a comprehensive solution that sets a level playing field, really encourages free market. We struggle with the same things Leanne just said, and be able to go out there and say, okay, this is another way, and yes, you have the ability to have this option. Take away those barriers.
And when Lynn talks about a comprehensive solution, it's so important because we've witnessed it now for decades, where the reference to playing whack-a-mole, if you don't have comprehensive enough reform, it will just shift. And so there are offshore affiliates of PBMs that kind of help shield some of the rebate dollars we were discussing. And so to me, what's next is making sure we do have a comprehensive enough solution out in the marketplace.
Thank you so much, Leanne Boyd, CEO of Avinity, and Lynn Riley, President of Pharmacy Benefit Dimensions. We really appreciate you sharing your point of view with us today.
Thank you.
Thanks. Thank you all.